Welcome back. Medical experts agree there are no safe tobacco products, and that includes e-cigarettes. But many people turn to vaping as a way to quit traditional cigarettes. As Dominic Garcia reports, University of California researchers are trying to find out if that actually works.
It's a switch a lot of smokers make, but does vaping help them kick the habit?
In our study, when we look at the US population of cigarette smokers, we're just not seeing that e-cigarettes are helping them quit.
Natalie Quach is a biostatistics PhD student at UC San Diego and the study's first author. She says they analyzed data from over 6,000 US smokers.
One of our findings shows that among smokers who vape daily, there's about a 14.7 percentage point drop in vaping and smoking cessation rate.
Not only that, but they found vaping could have the opposite effect on someone who wants to quit.
So this suggests that vaping is prolonging both smoking and nicotine dependence among US smokers.
There's also the question, is vaping better for you? Natalie says we really don't know, but until we do you really want to risk it?
It's too early to tell what the long-term health consequences of e-cigarettes will be, but the early research that's come out so far shows that they're not harmless.
According to the CDC, almost 20% of Americans use tobacco products. Dominic Garcia, CBS News, Sacramento.
About a quarter of Americans visit at least one museum every year. In Switzerland, a visit may be medically necessary. Doctors in one Swiss town are giving museum prescriptions to patients they believe could benefit from a visit to one of 4 museums. The idea was inspired by a 2019 World Health Organization report that found the arts can boost mental health, lower the risk of cognitive decline, and reduce the impact of trauma. One doctor says he prescribed museum visits to 2 patients to encourage them to walk more, to get in better shape before planned operations. So far, about 500 museum prescriptions have been written. If successful, local officials plan on expanding the program to other arts like theater and dance. New artificial intelligence tools are changing the doctor's office. The technology isn't replacing your doctor, but promises to help behind the scenes with note-taking and diagnostic tools. We recently got to test this new tech that you could see at your next checkup.
This is an AI system that's going to be listening to us, and it's going to be scribing the note.
Right on his phone, Dr. Robin Baradarian is running a high-tech tool called Suki AI.
Any family history of any problems.
While he talks with patient Michelle Barone in an exam,
I feel burning up. Sometimes I even feel it in my ears.
Suki takes notes, letting the doctor focus on her.
I remember going to doctors, their back was turned as they were trying to write notes down, looking at the computer. It's not personable.
It helps you concentrate on the important aspects of being a doctor.
Suki does more than transcribe. It can summarize a visit, update billing records, and even give a second opinion, all for a few $100s per doctor per month.
That's the AI that's listening.
The company's founder and CEO, Puneet Soni, let us do a simulation to see how it works.
I'm having some pain in my lower back. It started about a week ago.
Creating a detailed clinical note with recommendations.
It happens almost instantaneously.
10 to 15 seconds at best, right?
Everything along here, it says tap to accept, so the doctor has to verify that that's accurate.
Right.
Years ago, the former Google engineer recognized how AI could reshape medicine.
Suki's promise is not that it's going to replace doctors. It's that if you combine an AI like Suki with a doctor, they're going to be better than almost any doctor in the world at treating you.
It's also a treatment for doctors who've long been burned out by paperwork. Dr. Baradarian was spending up to 8 hours a week on non-clinical work.
I know this is the future of medicine. It actually has a very beneficial role in bringing back the rapport and the relationship between patient and the physician.
An intelligent tool that could be a prescription for medicine. In an emergency, every second counts. Helicopters can be crucial for first responders, as are drones. But there are times that something in between is needed to get the job done.
GoAero, we are focused on this singular mission, which is saving lives. And we are creating all new aircraft.
Gwen Leiter is the CEO of GoAero. The company launched a worldwide competition with a $2 million prize, challenging more than 200 teams in 85 countries to build a compact aircraft that can carry a first responder, evacuate victims, and deliver critical supplies when other options can't.
Whether it is a wildfire in New Jersey or North Carolina or Los Angeles, or flooding in Asheville or in Spain, or frankly, everyday medical emergencies where there is a car accident and traffic stops.
That last scenario is exactly what inspired Leiter. She was stuck in traffic when her dad started having chest pains. Now she hopes new aircraft could get help to people even faster. After the break, a natural sweetener could be a help this allergy season, and why some states are banning artificial food dyes.